Chapter 1. System Initialization. The surgical lights glowed steadily inside Orion General Hospital. Located in the advanced medical state of Velmora, within the country of Etheron, the hospital was known for precision, discipline, and results. Dr. Ethan Walker stood at the assistant position in Operating Room 3. Posture straight. Eyes focused. No wasted movement. Scalpel. Dr. Amelia Hart's voice was calm and exact. Ethan picked up the scalpel and placed it in her hand without delay. Amelia glanced at him briefly. "Timing acceptable," she said. Ethan nodded. "Understood." No nervous reply. No hesitation. Only acknowledgement. "This is a standard appendectomy," Amelia continued. "Observe each step. Precision matters." Ethan focused on the surgical field. Incision. Clean entry. Correct depth. Every movement followed a clear logic. Ethan analyzed internally. Angle approximately 35 degrees, controlled pressure, minimal tissue disruption. Then, ding. A soft sound appeared in his mind. Ethan remained still. Ding. Surgical system activated. A transparent blue interface appeared within his vision. Task assigned. Assist in appendectomy. Objective. Identify all critical surgical steps. Reward. Foundational surgical analysis, level 1. Ethan processed instantly. Visual learning system, real-time assistance, task-based progression. No confusion. Only acceptance. As Amelia continued, Ethan's perception changed. Highlighted overlays appeared. Appendix. Cecum. Vascular pathways. Optimal dissection zones. Each labeled clearly. Retractor, Amelia said. Ethan responded immediately. Correct placement. Correct angle. Stable hold. Amelia paused briefly, then continued. Adjustment not required, she said. A subtle acknowledgement. The procedure advanced. Dissection. Isolation. Removal. Ethan followed each step with precision. Ding. Progress, 76%. Focus maintained, he noted internally. Amelia worked efficiently. Every motion exact. Ethan spoke calmly. Blood supply isolated. Minimal risk. Amelia glanced at him. You're observing properly today. Ethan replied. Improved clarity. A slight pause. Then, try to maintain it, Amelia said. Tone neutral, but not dismissive. Ethan nodded. Understood. The surgery moved to closure. Suturing began. Ethan carefully observed technique. Needle angle. Thread tension. Not structure. All stored mentally. Ding. Task completed. Reward unlocked. Foundational surgical analysis, level 1. A structured understanding formed in his mind. Step hierarchy. Decision flow. Execution logic. Ethan remained composed. No visible reaction. Procedure complete, Amelia said. The team began cleanup. Ethan stepped back. System interface flickered. Ding. New task preparing. Before he could analyze further, Amelia spoke again. Dr. Walker. Ethan turned. Yes. She studied him briefly. You were less inefficient today. Ethan responded immediately. Progress confirmed. A faint pause. Then, Amelia's lips moved slightly. Almost a smile. Don't upgrade your confidence faster than your skill, she said. Ethan replied calmly. Confidence is within safe limits. Amelia turned away. Good. Then report to the surgical skills lab after shift. Ethan nodded. Understood. As she walked out, he noticed something subtle. Her tone had changed. Slightly lighter. Not cold. Not warm. Balanced. Ethan looked at the system screen again. Ding. Training task incoming. A new phase had begun, and Ethan intended to complete every objective. Efficiently. Chapter 2. Precision Protocol. The surgical skills lab in Orion General Hospital was silent. Organized. Efficient. Ethan Walker entered and immediately scanned the room. Practice stations. Suturing kits. Synthetic tissue modules. Everything arranged for controlled training. He selected a station and sat down. Ding. The system interface appeared. New task assigned. Precision suturing training. Objective. Complete 10 perfect sutures within 15 minutes. Evaluation criteria. Angle, depth, tension, consistency. Reward. Precision control, level 1. Ethan read carefully. Clear parameters, he said. He picked up the needle holder. Positioned the thread. Observed the synthetic skin. Begin. First stitch. Entry angle slightly off. Thread tension uneven. Result, suboptimal. Ethan paused. Correction required. Ding. Guidance activated. Overlay appeared. Angle correction, 14 degrees. Pressure reduction, 20%. Ethan adjusted immediately. Second attempt. Smooth entry. Balanced exit. Thread aligned. Acceptable, he noted. Ding. Progress, 2 out of 10. He continued. Each stitch improved. More controlled. More efficient. Time passed. Ding. Progress, 6 out of 10. His hands moved steadily now. No unnecessary motion. No hesitation. Efficiency increasing. Ding. Progress, 9 out of 10. 1 remaining. He aligned carefully. Executed the final stitch. Clean. Precise. Consistent. Ding. Task completed. Reward unlocked. Precision control, level 1. A subtle enhancement flowed through his hands. Micro adjustments became easier. Grip stabilized. Control improved. Ethan flexed his fingers. Fine motor accuracy increased. Not bad. A voice came from behind. Ethan turned. Dr. Amelia Hart stood near the entrance. Observing. Ethan stood up. Training completed. Amelia walked closer. Examined the sutures. Spacing consistent. Knots clean. Professional level. She nodded slightly. Acceptable output. Ethan replied. System-assisted optimization. Amelia raised an eyebrow. System. Ethan paused for half a second. Training method, he corrected. Amelia looked at him for a moment. Then, you're improving faster than expected. Ethan responded. Efficiency priority. Amelia crossed her arms. Let's see if that holds in real conditions. Ethan met her gaze calmly. Testing is welcome. A short pause. Then Amelia said, Report 2 or 2 tomorrow. Ethan nodded. Understood. She turned to leave, but stopped briefly. Without looking back. Try not to slow me down this time. Ethan replied instantly. Speed will match requirement. A faint smile appeared on Amelia's face. Barely visible. Then she left. Ethan looked back at the suturing board. Then at the system. Ding. New task incoming. The interface flickered. Next challenge loading. Ethan remained still. Focused. Prepared. This progression would not stop. Chapter 3. Assisted Execution. Operating Room 2 was already prepared when Ethan entered. Sterile environment. Instruments aligned. Monitors active. Everything was set for precision. Dr. Amelia Hart stood beside the operating table, reviewing patient data displayed on a floating screen. Appendectomy again? Ethan asked calmly. Amelia glanced at him. No. Slightly more complex. Inflamed appendix with adhesion. Ethan nodded. Increased difficulty acknowledged. Amelia's eyes narrowed slightly. You've started talking like a system. Ethan replied without hesitation. Efficiency in communication. A brief pause. Then, just don't start malfunctioning, Amelia said. Ethan almost smiled. Unlikely. The patient was prepped. Anesthesia stable. Vitals normal. Begin, Amelia said. The incision was made. Clean and controlled. Ethan focused. Ding. System activated. Task assigned. Assist in adhesion-based appendectomy. Objective. Provide correct instrument timing and maintain field stability. Bonus objective. Predict next surgical step. Reward. Advanced surgical mapping, level 1. Ethan processed instantly. Prediction required, he noted internally. As Amelia proceeded with dissection, Ethan observed carefully. Tissue layers slightly irregular. Adhesion present near intestinal wall. Forceps, Amelia said. Ethan handed it immediately. No delay. No correction needed. Ding. Timing accuracy, 92%. Good, Ethan thought. He continued observing. Amelia shifted angle slightly, preparing for deeper dissection. Next step, separation of adhesion. Ethan calculated. Scissors. Ethan handed them before the request was fully spoken. Amelia paused, looked at him briefly, then continued. Ding. Prediction success. Ethan maintained retraction. Stable. Precise. No unnecessary pressure. The adhesion was carefully separated. Minimal bleeding. Clean exposure achieved. Maintain field, Amelia said. Ethan adjusted instantly. Angle optimized. Visibility improved. Better, Amelia commented. Ethan replied. Field stability at optimal level. Another short pause. You really don't talk like a normal resident, Amelia said. Ethan responded calmly. Normal output is inefficient. Amelia exhaled softly, almost amused. The procedure continued. Appendix identified. Inflammation confirmed. Ligature, Amelia said. Ethan passed it smoothly. Ding. Timing accuracy, 96%. His movements were now fully synchronized. No hesitation. No wasted motion. It was as if the system and his body were aligned. Cut. Ethan anticipated. Instrument ready before command completion. Amelia accepted it without comment. But her eyes had changed. Focused. Evaluating. The appendix was removed successfully. No complications. Closure phase, Amelia said. Ethan leaned slightly closer, observing suturing technique again. But this time, he understood deeper details. Thread tension adjustments. Layer alignment. Micro movements. Ding. Learning sync increased. Ethan analyzed internally. Skill replication possible within next session. Amelia finished the final stitch. Procedure complete. The monitors remained stable. Everything had gone smoothly. Ethan stepped back. Ding. Task completed. Reward unlocked. Advanced surgical mapping, level 1. A structured visualization appeared in his mind. Surgical pathways. Decision trees. Error prevention routes. Ethan processed rapidly. Mapping integrated. Dr. Walker. Ethan looked up. Amelia was watching him. You assisted without slowing the procedure. Ethan responded. Performance within acceptable range. Amelia crossed her arms. Don't get used to hearing that. Ethan replied instantly. Expectation remains neutral. A slight smile appeared on her face. Quick. Subtle. But real. Report tomorrow, she said. More complex case. Ethan nodded. Prepared. Amelia turned and walked toward the exit. Then paused. Without turning. Try predicting faster next time. Ethan replied. Improvement already in progress. She left. Ethan looked at the system. Ding. New task preparing. Difficulty level increasing. He remained still. Focused. Ready. Each task was bringing him closer to mastery. Chapter 4. The Surgical Floor. Morning rounds at Orion General Hospital began precisely at 7 a.m. No delays. No excuses. Dr. Ethan Walker stood among a group of residents in the surgical wing corridor. Around him were other doctors. Different personalities. Different skill levels. Different attitudes. All right, listen up, said Dr. Lucas Reed, a second-year resident known for his sharp tongue. Today's cases are heavy. Try not to embarrass the department. Ethan glanced at him. Performance is measurable. Embarrassment is subjective. Lucas smirked. Still talking like a robot, huh? Before Ethan could respond. Silence. Dr. Amelia Hart walked in. Instantly, the entire group straightened. Her presence alone reset the atmosphere. We'll begin rounds, she said. Follow in order. The team moved. Room by room. Case by case. Ethan observed everything. Patient conditions. Post-op recovery. Medication adjustments. Ding. Passive learning active. Data started organizing in his mind. Patterns forming. Connections building. Patient 12, Amelia said. Post-appendectomy. Report. Lucas stepped forward. Vitals stable. Mild pain. No infection signs. Amelia nodded slightly. Then looked at Ethan. Your observation? Ethan spoke calmly. Recovery rate above baseline. Discharge possible within 24 hours. Lucas frowned. That's too early. Ethan replied. Based on current data, delay is unnecessary. Amelia observed both. Then said, Ethan is correct. Lucas went silent. Ethan remained still. No reaction. Just confirmation. They continued rounds. At the end, Amelia turned to the group. Afternoon case assignments will be posted. She paused briefly. Then, Walker, or 5. Lucas looked surprised. That's a higher tier case. Ethan nodded. Understood. Amelia walked away. Lucas stepped closer. Don't mess it up, he said. Ethan replied. Failure probability reduced. Lucas sighed. You're impossible. Ethan turned toward the OR wing. Ding. New task incoming. The system interface appeared again. Task assigned. Assist in mid-level abdominal surgery. Objective. Maintain accuracy under increased complexity. Bonus. Independent action approval. Ethan processed instantly. Difficulty increased. Acceptable. This was no longer just training. This was progression. And the system was pushing him forward. Chapter 5. Rival Presence. Orion General Hospital wasn't the only top medical center in Velmora. Across the city stood Nova Medical Institute. Advanced. Competitive. Unpredictable. And today, they had sent someone. Ethan stood near or 5 when a group entered the surgical wing. Different uniforms. Different insignia. One of them stepped forward. Tall. Confident. Sharp gaze. Dr. Ryan Cole. He introduced himself. Nova Medical. Lucas whispered. Great. A show-off. Visiting surgeon for joint evaluation, Ryan added. Amelia arrived moments later. You'll observe only, she said. Ryan smiled slightly. I might learn something. Ethan noted. Confidence level high. The case began. Mid-level abdominal surgery. More complex than previous procedures. Ryan stood on the opposite side. Watching. Evaluating. Ethan assisted Amelia. Ding. Task active. Every movement mattered. Timing. Precision. Control. Ryan spoke. Your assistant seems quiet. Amelia replied. He works. Ethan continued without reacting. The surgery progressed. A minor complication appeared. Unexpected bleeding. Lucas hesitated. Ryan watched closely. Ethan acted. Suction. Correct. Field cleared. Clamp. Ethan added. Amelia followed. Bleeding controlled. Stability restored. Ryan's expression shifted slightly. Fast response, he said. Amelia continued. Expected. The procedure finished smoothly. Afterward, Ryan approached Ethan. You predicted that? Ethan replied. Pattern recognition. Ryan smiled. Interesting. Lucas muttered. He's getting attention now. Amelia spoke. Next time, respond faster, Walker. Ethan nodded. Improvement ongoing. Ryan turned to leave, but paused. I'll be back, he said. Ethan watched him go. Ding. Rival detected. Ethan processed the notification. New variable introduced. The system was evolving. And so was the competition. Chapter 6. System Upgrade. The surgical skills lab was quiet again. Ethan stood alone. Focused. Ding. System notification. Accumulated performance threshold reached. Upgrade available. Surgical system level 2. Ethan responded immediately. Execute upgrade. Ding. Upgrading. A brief pause. Then, new interface loaded. Enhanced visuals. Faster processing. New features unlocked. Predictive simulation. New task assigned. Simulate emergency scenario. Objective. Complete procedure under time constraint. Timer, 10 minutes. Begin. Simulation started. Virtual surgical field appeared. Critical condition. Internal bleeding. Ethan acted instantly. Steps executed rapidly. No hesitation. Guidance overlay active. Ding. Time remaining, 2:14. Final action. Stabilization achieved. Ding. Task completed. Reward. Reaction speed boost. Ethan exhaled slowly. System efficiency improved. Still training? Amelia's voice came from behind. Ethan turned. Yes. She looked at the setup. Simulation? Ethan nodded. Emergency scenario completed. Amelia crossed her arms. Good. Real one tomorrow. Ethan replied. Ready. She studied him briefly. You don't seem stressed. Ethan answered. Stress does not improve performance. A small smirk appeared. Keep telling yourself that. Ethan remained calm. Data supports it. Amelia shook her head slightly. Let's see. She walked out. Ethan looked at the upgraded system. New challenges. Higher level. Faster growth. Everything aligned. This was no longer basic training. This was advancement. And he was keeping pace. Chapter 7. Emergency call. The hospital alarm sounded suddenly. Emergency code activated. Code read. Trauma incoming. Ethan immediately moved toward the emergency wing. No hesitation. No delay. Multiple doctors gathered. Lucas. Nurses. Support staff. Amelia arrived seconds later. Severe abdominal trauma, she said. Prepare or immediately. Ethan stepped forward. Ready for assist. Amelia nodded. Follow. The patient arrived. Critical condition. Heavy bleeding. No time for delay. Ding. Emergency task activated. Objective. Assist in life-saving surgery. Difficulty. High. Ethan focused completely. No distractions. No noise. Only process. The surgery began instantly. Amelia worked fast. Precise. Controlled. Ethan matched her pace. Instruments ready. Field clear. Movement synchronized. Pressure drop, Lucas said. Ethan responded. Adjust fluid input. Amelia followed. Stabilization improved. Clamp. Ready. Everything aligned. No wasted second. The operation continued under pressure. But control remained. Final steps executed. Stability restored. Patient secure, Amelia said. Silence followed. Then, relief. Lucas exhaled. That was intense. Ethan remained calm. Process completed. Amelia looked at him. You kept up. Ethan replied. Required standard achieved. A brief pause. Then, don't slow down tomorrow, she said. Ethan nodded. Improvement ongoing. The system interface appeared again. Ding. High difficulty task completed. Reward. Advanced decision sync. Ethan processed the update. Another step forward. Another level gained. This was only the beginning. Chapter 8, Department Shift. The morning briefing room was more crowded than usual. Senior surgeons, residents, even administrative staff. Ethan stood near the back, observing the arrangement. Cross-department coordination will begin today, announced Dr. Victor Hale, head of surgery. Due to increased emergency cases, departments will temporarily merge operations. Murmurs spread across the room. Lucas leaned slightly toward Ethan. Means more chaos. Ethan replied. Means more data. Lucas shook his head. You really are different. Amelia stepped forward. Assignments are updated. Some of you will assist outside your usual roles. Her eyes briefly moved toward Ethan. Walker, you'll rotate between surgery and emergency. Lucas frowned. That's rare. Ethan nodded calmly. Expanded exposure accepted. Dr. Hale added. Performance will be monitored closely. Ethan processed that instantly. Evaluation system external to internal system. Ding. New task assigned. Multi-department adaptation. Objective. Maintain performance across varied environments. Reward. Adaptive response boost. Ethan acknowledged internally. Task accepted. The meeting ended. As doctors dispersed, a new voice interrupted. Looks like you're getting special treatment. Ethan turned. Dr. Ryan Cole stood there, arms crossed, observing. Ethan replied. Assignment based on performance metrics. Ryan smiled slightly. Or potential. Ethan remained neutral. Potential must be proven. Ryan stepped closer. Good. I prefer competition. Lucas whispered. He's annoying. Ethan replied softly. Noted. Amelia walked past them. Save the conversation for after work, she said. Both fell silent. Ethan followed her toward the operating wing. Ding. Task active. New environment. New variables. But for Ethan, only one thing mattered. Execution. And the system was already adapting. Chapter 9, Emergency Rotation. The emergency department was nothing like the surgical wing. Noise. Movement. Unpredictability. Ethan entered and immediately began scanning. Multiple patients. Doctors moving quickly. Nurses coordinating. New face, a voice said. Ethan turned. A female doctor stood there. Confident posture. Fast eyes. Dr. Lila Vance. Emergency lead. Ethan nodded. Dr. Ethan Walker. Surgical rotation. Lila looked him up and down. You look too calm for this place. Ethan replied. Calm improves efficiency. Lila smirked. We'll see. A stretcher rushed in. Trauma case, someone shouted. Lila moved instantly. Walker assist. Ethan stepped forward. Ding. Emergency task active. Objective. Assist in rapid stabilization. Time constraint. Critical. Ethan analyzed quickly. Vitals unstable. Bleeding. Shock risk. Pressure stabilization required, he said. Lila glanced at him. Good. Act on it. Ethan followed. Precise movement. No delay. Force secured. Good, Lila replied. She worked fast. Ethan matched her pace. Different from Amelia. Less structured. More instinct-driven. Ethan adapted. Ding. Adaptation progress. 68%. Not bad, Lila said. Ethan responded. System adjusting. She raised an eyebrow. System. Method. Lila laughed slightly. You're interesting. The patient stabilized. Nice work, she said. Ethan nodded. Objective achieved. Lila leaned closer. You're not like other residents. Ethan replied. Comparison unnecessary. She smiled. Let's see how long that confidence lasts. Ethan looked at the system. Ding. Adaptation increased. New patterns. The training hall was prepared. Multiple stations. Different tasks. Suturing. Incision simulation. Reaction tests. Ryan stood at one side, watching, smiling slightly. This should be interesting, he said. Amelia supervised. Begin. Ding. Evaluation task active. Objective. Outperform peers. Ethan moved first. Suturing station. Clean execution. Fast. Accurate. Ding. Score high. Next station. Incision simulation. Perfect angle. Minimal error. Lucas struggled slightly. Ryan performed smoothly. But Ethan was faster. More precise. Ding. Ranking updated. First. Ryan noticed. His expression sharpened. Impressive, he said. Ethan replied. Within expected range. Ryan smiled. We'll test that. Final station. Reaction timing. Signals flashed. Ethan responded instantly. No delay. Ding. Perfect score. The session ended. Amelia reviewed results. Top performer, Dr. Ethan Walker. Silence. Lucas looked surprised. Ryan smirked. Now it's official. Amelia looked at Ethan. Maintain this level. Ethan nodded. Continuity planned. Ryan stepped closer. I'm not losing next time. Ethan replied. Competition acknowledged. The system activated again. Ding. Performance milestone achieved. Reward. Advanced reflex enhancement. Ethan processed it calmly. Progress continued. And the gap was increasing.